Hello, this is Dr. David Green, CEO of the California Pain Network. Today's topic is what you need to know about facet injections. Facet joints are small, thumbnail-sized joints on either side of the spine at every level, all the way from the neck down to the sacrum. These joints include cartilage, just like the hip or the knee, and they combine to allow for the incredible range of motion of the spine that we normally have. So looking from the back, this is what the facet joints look like. They're on the left and the right at every level, okay? And even though they're small, they do have cartilage just like the hip or the knee, but they can develop arthritis. So facet joints are prone to arthritis just like any other cartilaginous joint. They can definitely cause a lot of pain, even though they're only about the size of a thumbnail. Typically, the pain that's developed is in the vicinity of the arthritis, but usually you have several involved at the same time. So here's a facet joint that's arthritic. You can see the excess bone that's formed. The red denotes inflammation, okay? And there's excess bone, there's soft tissue, and you usually have it at multiple levels. So here's looking at it kind of obliquely. Here's the back of the spine, these little bumps that you can feel on your back of your skin. These are the transverse processes, and then the nerve root, nerve root, nerve root. What you can see is the overgrowth of the bone and soft tissue here can lead to pinching of the nerve root as it tries to get out, okay? That ends up being called spinal stenosis. So why are facet joint injections performed? They are not a great surgical answer when it comes to facet arthritis, all right? Let's say you have multiple levels of arthritis. Are you going to fuse those three levels? We don't have a joint replacement for these levels like we do for the hip or the knee, so they end up responding well to steroid injections, which can provide months of pain relief. Facet injection is an outpatient procedure. It's very short. It takes about 10-20 minutes. Modern pain doctors use fluoroscopy, which is real-time x-ray. It usually does not require IV sedation, although it can if a patient has had previous really good experience with that or they're claustrophobic. Normally the skin is numbed up along with the soft tissues down to the facet joint area. The needle is placed into the joint itself, and then some dye is injected to make sure that the needle is actually where it's supposed to be, and then the steroid medication and the numbing medication is placed. You can treat several levels at the same time, same procedure. For instance, you can treat this one and then this one, and the procedure can be repeated every few months. You don't want to do it too often because too much steroid can be bad for one's body. How well do they work? Well, studies have shown that 82% of patients receive pain relief that takes away over 50% of a person's pain, and over 3/4 of patients are able to significantly improve their function, such as walking and ability to take care of their daily living activities. And that's with or without steroid. Even with just numbing medicine, it has a great effect. The average duration of pain relief is just shy of 4 months, and the same results were seen in multiple studies, which gives further definitive outcomes. It's an excellent non-operative method of achieving neck or back pain relief due to spinal arthritis. And what happens if the pain comes back? Well, there are 3 treatment options. One is you can simply repeat the facet injection. So here's the back of the spine, facet joint, facet joint, facet joint, facet joint. If this is a symptomatic joint, you can just put the needle back in and do another steroid injection. Okay? Another option is to not put the needle all the way into the joint, but actually to put it around the joint where these tiny little nerve endings are, called the medial branches. They supply sensation to the joint, no motor function, just sensation. So if you do a medial branch block with numbing and possibly steroid, you can actually provide months of pain relief by not even going into the joint. Okay? Now, if that wears off, you can move on to what's called a radiofrequency ablation. Other people call it radiofrequency neurotomy, radiofrequency lesioning, rhizotomy, whatever. It's all the same. Thermal energy is applied through a probe into this area, and it deadens these medial branches, and it can provide pain relief for 12 to 18 months. It's really amazing, the outcomes. There are very, very low risks with any sort of facet injection. There's a slight risk of infection, bleeding, allergic reaction. The needle does not go into the epidural space, so there's negligible risk of even a nerve root injury, and that's a good thing. The California Pain Network offers top non-operative pain treatments throughout the state, including San Diego, Oceanside, Orange County, LA, Bakersfield, Inland Empire, all the way up to San Francisco. There's over 50 insurances accepted and over 25 treatment options. Most doctors do both, medication management and interventional treatments such as what's mentioned here. There's typically over 90% overall success rates with patient treatment. The doctors are board certified, they're award winning. Check us out online at californiapainnetwork.com, and then visit us, call us on the phone at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.